The theory of illness trajectory was created by Carolyn L. Weiner and Marilyn J. Dodd. Weiner had a bachelor's degree in interdisciplinary social science and a master's and doctorate in sociology. She was an assistant research sociologist and then became a full professor. Dodd was an RN. She had her bachelor's, master's, and doctorate in nursing. She was a nursing instructor, an assistant professor, and then a full professor. And she received numerous awards and was also designated as a living legend by the American Academy of Nursing. They developed this theory to expand the scope of the illness trajectory framework because previous theoretical assumptions have limited the use of this body of work on coping with illness. It is classified as a mid-range theory because it addresses a specific concept of coping with the uncertainty of chronic illness and identifies testable nursing questions and includes patient details. The theorists had worked in oncology nursing and research focused on organization, healthcare institutions, chronic illness, and health policy, so they both had experience with chronic illness. The work of Corbin and Strauss influenced the theorists' definition of work and how living with illness is affected by social relationships, because coping with uncertainty involves patient interactions with others, making it extremely variable and dynamic. This theory addresses a theoretical pitfalls such as defining coping as different strategies used to manage disruptions, attempts to isolate responses to one event, and identifying responsive behaviors as an assigned value such as good and bad, and describing these as coping. The empirical evidence used in this theory was qualitative data from structured interviews from a study on family coping and self-care during 6 months of chemo. To address both the nursing meta-paradigm and the major assumptions, the person is the focus, and the person is made up of the person with the illness, the family, and the healthcare providers involved. The person attempts to manage the effects of living with the illness within various contexts, including the environment. Quality of nursing care, the environment, and health influence the degree of uncertainty the patient experiences. Different people that make up the person have different types of work, but the patient is the central worker. The relationships among those involved affect the management of the illness and the fate of the patient because living with an illness produces consequences that affect the lives of all involved. Some of the major central concepts and definitions include key elements of the biographical context, which are identity, which is the conception of self at a given time that unifies multiple aspects of self and is situated in the body. Temporality, which is perceptions of the past, present, and possible future interwoven into the conception of self, and body, which is activities of life and derived perceptions based in the body. Total organization is the network of players, including the sphere of work that is made up of the person and all those he or she interacts with. Forms of work within an illness include all activities of life and living. States of uncertainty include uncertain temporarily, which is the expectations regarding the flow of life events are disrupted. Uncertain body, which is the ability of the ill person to perform usual activities. And uncertain identity, which is interpretation of self is distorted because the body cannot perform as usual. There are also uncertain abatement works, which include pacing, becoming professional patients, seeking reinforcing comparisons, engaging in reviews, setting goals, covering up, finding a safe place to let down, choosing supportive network, and taking charge. The theoretical assertions and propositions involved include central themes throughout different stages, where the physical status of the patient and the social, psychological consequences of illness and treatment. Uncertainty equals loss of control, which they label as the most problematic facet of living with cancer. The goal of nursing with this theory is a better understanding of how patients tolerate uncertainty and control in the human experience with chronic illness. In summary, this theory improves understanding of how patients and families attempt to decrease uncertainty through a dynamic flow of illness events, treatment situations, and the players involved in care. This schematic represents the concepts and their interrelationships associated with this theory. It specifically shows the relationships among those involved and how they affect the management of the illness and the fate of the patient, because living with an illness produces consequences that affect the lives of all involved.
The primary logical form for Weiner and Dodd's theory is grounded theory and inductive reasoning. Tolerating uncertainty was identified as the focal point that incorporates the theoretical assertions. To determine the dimensions of uncertainty, a systemic coding process was utilized. The experience reported by the participants and knowledge of illness trajectory was used to ground the data in the theory. There were no documented identified flaws in logic. Wiener and Dodd's theory has been referenced in a limited number of published works, including concept analysis and state of the science papers. It has been praised for the broad focus of qualitative data collection versus quantitative data collection. The application of Lazarus and Folkman's use of problem-based or emotion-based coping has been noted within Wiener and Dodd's theory. The variation and range of abatement are unique in relation to coping with uncertainty of illness, and make it an important part of Wiener and Dodd's theory. Wiener and Dodd are internationally renowned educators who hold conferences and seminars on their theory of illness trajectory and other works. Their presentations shine light on use of illness trajectory models and how data-based research contributes to cancer care programs. The theory provides nurses the understanding of loss of control experienced by cancer patients. Utilizing the theory in oncology care can help to identify uncertainty experienced by patients and help create coping mechanisms. Understanding of illness trajectory aids in treatment of individuals with chronic diseases. In this hypothetical scenario, using Wiener and Dodd's theory of illness trajectory, our subject is a premature infant whose gestational age is 23 plus 2. The mother delivered by primary C-section secondary to severe IUGR, pre-E, and reverse diastolic flow. The infant's postmenstrual age is 37 plus 4. The infant has a history of bilateral cerebral hemorrhages, long-term mechanical ventilation and oxygen use, neck with perforation and intestinal resection, and feeding intolerance and difficulty. The infant is currently on 1 liter nasal cannula 100% oxygen. The infant also has a ventriculoperitoneal shunt and a G-tube. Our setting is a regional NICU, and the target of care is the infant and the infant's parents. In the utilization of illness trajectory in patient care, the nurse must have an understanding of the type and level of uncertainty the parents are experiencing. Illness trajectory also includes informing the parents of potential complications and possible long-term outcomes of their infant's illness and life expectancy. Utilization includes incorporation of the parents in infant care and understanding that anger or overstepping may be coping mechanisms. Education is key to incorporating illness trajectory.
Erikson's modeling and role modeling theory background. Helen Erikson obtained a diploma from Saginaw General Hospital in Saginaw, Michigan in 1957. Erikson received the following degrees from the University of Michigan: baccalaureate in nursing in 1974, dual master's degrees in psychiatric nursing and medical surgical nursing in 1976, and a doctorate of educational psychology in 1984. Erikson's professional experience began as head nurse of the Midland Community Hospital Emergency Room in Midland, Texas. Erikson's academic career began as an assistant instructor in the RN Studies program at Michigan School of Nursing. She then went on to serve as dean for the undergraduate studies and assistant professor for the University of Michigan. Erikson was awarded the Holistic Nurse of the Year award in 2014 from the American Holistic Nurses Association. Erikson's theory is titled the Modeling and Role Modeling Theory and was formed in the late 1950s. Helen's theory was influenced by her father-in-law Milton Erikson, Maslow, Piaget, and Engel. Milton Erikson believed that each human has a unique view of the world and needs to maintain his or her role in unique ways, and that the practice of healthcare professionals was to help the client succeed in living quality lives and growing to the maximum of their potential. A mid-range theory is more specific and provides concrete connections between grand nursing theories and nursing practice. The concepts tend to be more verifiable in practice. This theory is verifiable because the role modeling portion involves the nurse applying interventions. Applied interventions can be measured as outcomes. Erikson's practice experiences and theoretical sources. This theory was developed in a retroductive process. and the original model was derived from Erikson's clinical and personal life experiences. The works of Piaget, Engel, Erikson, Maslow, and Milton H. Erickson were then integrated into the original model. This allowed Erikson to name, articulate, and refine a holistic theory for nursing. Evelyn Tomlin and Mary Swain affirmed and approved Erikson's practice model and helped her expand and integrate concepts and theoretical relationships. Maslow's theory of human needs was used because Erikson, Swain, and Tomlin believed that people's basic needs must be met before they can grow holistically. They believed that unmet needs could cause mental and physical distress or illness, and satisfaction allows the person to reach health, prosper, grow, and develop. Piaget's theory of cognitive development provided a framework for understanding the process of thinking, and Erik Erikson's work on psychosocial development through the lifespan provided a theoretical basis for understanding the psychosocial evolution of the individual. The works of Winnicott, Klein, Mahler, and Bowlby on object attachment were integrated to develop and articulate the concept of affiliated individuation. Erikson drew on the theory of object attachment and said that when an object repeatedly meets an individual's basic needs, attachment to that object occurs. Erikson believed that object attachment is essential to healthy growth and development. Erikson's modeling and role modeling theory majored considerations of theory and concepts and relationships. The client or person in this theory participates in his or her own care. The client is considered a member of the decision-making team and is always the primary source of data. The environment is not specified in the theory as an entity of its own. These theorists see the environment as the interaction between oneself and others, both culturally and individually. Health is defined as being a dynamic state of physical, mental, and social well-being. These theorists believe that a person's spiritual drive has greater influence than any of the other subsystems. Nursing. Erikson believes that the nurse-client relationship is interactive and one in which the client is able to reach an optimal state of health. The 5 aims of nursing interventions are to build trust, affirm, and promote client strengths, promote positive orientation, facilitate perceived control, and set health-directed goals. Modeling is the act of developing an image and understanding of the client's worldviews from within their perspectives and framework. It is the development of a mirror image of the situation from the client's perspective. Role modeling is the process in which the nurse organizes and nurtures the client in reaching, maintaining, and promoting health. Role modeling occurs when the nurse plans and implements interventions that are specific to the client. Concepts were drawn from the works of Maslow, Bowlby, Erikson, Engel, and Seale to create a new theory that described relations among needs, loss, grief, adaptation, developmental processes, growth, and well-being of the holistic person. The practice paradigm was derived from integrating philosophical assumptions with theoretical underpinnings. When a client's needs are met, the person forms object attachment. If they are not met, then it is considered a stressor. Those objects that repeatedly meet needs become attachment objects. These objects change as people move through various developmental stages. When attachment occurs, loss of attachment objects will result in feelings of loss. Loss is real, threatened, or perceived. The nurse creates an interactive and interpersonal relationship with the client. During this process, the nurse helps the client to identify, develop, and mobilize internal and external resources. These resources are needed to cope with life stressors, to grow and heal. During this process, it is important that the nurse has unconditional acceptance of the client. Erikson's first independent research study was designed to test the adaptive potential assessment model. Erikson also expanded and tested the concept of self-care knowledge. After innumerable requests for written materials, Modeling and Role Modeling, a Theory and Paradigm for Nursing book was written. Modeling and role modeling is based on the philosophy that all humans have the desire to live healthy, happy lives, to find meaning and purpose in their lives, and to become the most that they can be. When we use strategies that focus on the strengths of our clients, help them become more fully alive, and to live their lives to the fullest, then we are truly helping them grow, heal, and transcend. The goal of nursing in reference to the modeling and role modeling theory is to achieve a state of perceived optimum health and contentment.
Erikson's modeling and role modeling theory uses the logical form of retroductive thinking and cycling from inductive to deductive reasoning. This theory provides a group of central concepts and their relationships that are used for description and analysis. Since all humans are holistic systems that have basic needs, growth and optimal health cannot be achieved until basic needs are continuously met. To meet these needs, clients must perceive an optimal state of health and fulfillment as promoted by the nurse through client-nurse relationships. Erikson uses commonalities among people including holism, basic needs, affiliated individuation, attachment and loss, psychosocial stages, and cognitive stages. As related to nursing research, Erikson's theory proposes that a client's ability to contend with stressors is related to the ability to mobilize resources, which relies on their needs, deficits, and assets. Also, distressors are seen as unmet basic needs, while stressors are unmet growth. Nursing education is related to this theory because all nurses need to learn that the 5 goals of nursing intervention are to build trust, promote positive orientation of the patient, promote patient control, affirm and promote patient strengths, and setting mutual goals. In advanced nursing practice, this theory is applicable to the need for nurses to go above and beyond standard nursing care by facilitating patient steps toward optimal health by providing the patient with information, resources, and support. To nurture, nurses should provide care and comfort to patients. Nurses should apply unconditional acceptance by accepting patients for who they are and trying to understand their perceptions of optimal health. The patient is the one who knows how he or she needs to be helped. This middle range theory is important because it provides nurses with the reasoning and instruction on how to collaborate with clients to promote optimal perceptions of health. By using the modeling and role modeling theory, nurses should understand the basic needs, affiliated individuation, and need for satisfaction, growth, and development. Advanced practice RNs must use a holistic manner of care when treating patients, as shown in this theory. A hypothetical clinical scenario demonstrating the application of Erikson's modeling and role modeling theory is a first-time mother who is admitted to the labor unit in active labor. The mother has a birth plan and has certain expectations for her birth experience. Since this theory involves identifying nurse-client goals, promoting client strengths, control, positive orientation, and building trust, the nurse must first assess the client's goals. The mother-to-be states that she would like to have a natural birth with no use of pain medication, as well as minimal interruption of bonding after the baby is born if there are no complications. The nurse identifies these goals for care and promotes client control by allowing the client to make as many decisions as possible and making her feel heard. The nurse promotes the client's strengths by supporting her through the pain of labor and reminding her that she can achieve her wishes by providing a sense of empowerment. A fundamental element of this theory is the understanding that the client's needs are met only when the client perceives them as being met. Erikson's theory is the most appropriate for Mr. K's scenario. This is true because Mr. K's physical health issues must be resolved before his social stressors can be addressed. Mr. K must work with the nurse to create goals for his health, paving the way for the best possible health outcome as perceived by Mr. K. The nurse must promote Mr. K's strengths of caring for others by helping him realize he must first be healthy before he can take care of others. By letting Mr. K make autonomous decisions about his care, the nurse is promoting Mr. K's control of his own care. Altogether, Erikson's modeling and role modeling theory provides nurses with a sense of collaboration with the client in order to achieve optimal well-being. This middle-range theory gives insight about the need for clients to work with nurses to create personal health goals. The nurse should find and utilize client strengths and help the client to use them to enhance healing. Nurses must also understand that clients are only in an optimal state of health when the client perceives this to be true. A client's basic needs must be met before growth and perceived well-being can occur. Weiner and Dodd's theory of illness trajectory focuses on the person. The course of illness pertains to the total organization of the disease involving the patient, family, and healthcare professionals. The term work is focused on in this theory as the patient being the central worker, but also including varied players of the organization completing different types of work. Since other people besides the patient are focused on in this theory, the work of living with the ill has consequences that ripple throughout the organization. The patient, family, and nurses are all affected by the management of the illness and the fate of the person who is ill. This theory is generally applicable to caring for a cancer patient. The theory best used with Mr. K's scenario is Erikson's modeling and role modeling theory because Mr. K has various stressors in his life as well as physical ailments. Mr. K's physical condition must be treated before social stressors can be fixed. Mr. K and nurses must create mutual goals in which Mr. K believes in and wishes to meet. Mr. K's strengths must be affirmed and used to better his healing process. Mr. K must perceive his healing as the optimal state of his well-being before this goal is achieved. Nurses must find out what Mr. K's views of optimal well-being include. According to this case, Mr. K seems to view being able to care for his family as his number one priority. The theory of illness trajectory may not be the best theory for this case because Mr. K does not have cancer and his family is not caring for him. Although Mr. K's family would be affected by him being sick, Mr. K related more to the theory of modeling and role modeling due to the fact that his well-being relies on his physical health, giving him the ability to care for others.